Healthcare. Chances are you heard a lot about it. It's been in the news, Obama's been talking about it. But do you really know what it's all about? Do you really understand what's going on in Congress? Whether you're for it or against it, you need to know these facts to be an informed voter. As soon as President Obama was elected president, he said he wanted universal health care coverage. And universal health care is available to all citizens of a country that has such a program, where people will not have to pay for usually preventive care such as dental, mental health, and medical. The United States, in fact, is the only industrialized nation in the world currently that does not have universal health care. Obama, when he first introduced the idea, he said that he had basic guidelines that he gave, and then he pushed the minor details and the major details to Congress, which is currently in the Senate debating a form of the bill, and in the House has already passed a bill. But we'll talk more about the House and the Senate later in the video. However, Obama did have major outline that he wanted, and he wanted to make sure that people understood that this was a public health insurance option. This is not the only option for American citizens. If someone already has an insurance and they don't want to switch to this federally funded and government-run insurance, they don't have to. But there is this option for other people who do not have insurance right now, such as the homeless and those who are less fortunate. So it gives people an option, but it still allows them to stay with their current insurance if they do so wish to do so. Also, he wanted to make sure that there was no yearly cap on insurances. So for example, if you have only $1,000 available to you for dental health, you cannot surpass that before you have to start paying out of your own pocket. That would not happen in this bill. Also, there would be a cap on your own out-of-pocket expenses, so people cannot keep going into debt just because they're trying to pay for their own health insurance. So these were some of the general ideas that Obama had, and then he passed the major and minor details down to the Senate and the House. On November 7, 2009, the U.S. House of Representatives passed their own form of a health care bill. The vote was 220 to 215. 219 Democrats voted in favor of this bill, and 39 opposed it. And in fact, one Republican representative from Louisiana, Joe Coe, voted in favor of it. Abortion has been a highly debatable topic on the issue of health care. And in the House of Representatives form of the bill, it was decided that health care would not be federally funded by this new health insurance. However, there was a compromise for those who did want abortion to be funded on this bill. And that compromise was that abortion could be funded if it was a case of rape, incest, or if the mother's life was in danger. In fact, you can read a copy of the House of Representatives bill online. Just go to this website. However, just a warning, this website does provide 1,990 pages of information with this bill, so it's up to you. Now, as I mentioned earlier, the Senate has its own version of a health care bill that is currently being debated. Debate was opened on November 30th of 2009. However, there was debate on debating. They decided a week before that they were going to actually discuss the bill. So before this, they were debating on debating, but now they're actually debating the bill. So now they're getting somewhere. The main architect of this bill is the majority leader of the Senate, so in layman's terms, he is a head honcho, and he is a Democratic senator from Nevada, Harry Reid. At the time of this video, the Senate health care bill was in its early stages, and debate was just currently being opened. However, it has been made known that an amendment was passed, and the amendment expanded women's health care in the form of preventive screening, such as breast cancer, so there would be insurance for that. So that was at the time of this video. However, we will have to wait and see as to what else gets passed in the days to come. Once, or if, the Senate's health care bill gets passed, the Senate health care bill and the House health care bill will then come together into a joint conference committee, which will include members of the House and of the Senate. And there they will compromise on one simplified version of this bill. And once they decide on that, they will send that simplified version back to the House and back to the Senate. And there, each House of Congress will vote on it, and they'll need a majority vote in order to make this into law. Now, usually when a bill comes out of a joint conference committee, usually it's voted because they've had their ideas meshed together. And now both houses of Congress usually are able to express themselves in this one bill, and they usually vote on it. So we'll have to see what happens, but that's the healthcare right now.